Hello friends, this is part 2 of Medicine plus Pathology questions of Rajasthan Medical Officer exam, and these are purely PYQs which are taken from last 8 years. So let's start with the part 2 first question. First question is delayed healing results in. So delay first option is loss of function. This is true. Wound left open. No. Wound not opposed immediately. No. It is not related to delayed wound healing. Abnormal proliferation of the granulation tissue. Yes, this can be related, but not always. So, but whenever there is a delayed healing, then there is a loss of function of that particular area. So, answer will be option number A. Delayed healing will lead to the loss of function. Next question is scar tissue often results due to. So whenever we think about the scar tissue or the contracture, then we generally think that it occurs due to the disorganized collagen fibers, but in actual it occurs due to the organized collagen fibers. If we talk about the normal situation, in normal situation we have disorganized collagen fibers, but in the formation of the scar tissue or the contracture, there will be organized collagen fibers. So answer here will be option number 1, which is organized collagen fiber. Disorganized collagen fiber is seen in the normal situation, normal tissue. Next question is Sjogren syndrome is. So we know that Sjogren syndrome is autoimmune disease. So it is a direct question. Answer will be option number 3, autoimmune condition. Next question is hypothyroidism in children is called as. So this is again a direct question. Hypothyroidism in children is called as cretinism. And if we talk about the myxedema, then myxedema can be one is pretibial myxedema and another can be myxedema coma. So if we talk about myxedema, then pretibial is seen in hyperthyroidism and myxedema coma is seen in hypothyroidism. And goiter generally occur in adults. So hypothyroidism in children is called as cretinism. Option number 1 will be the correct answer. Next question is of the four ocular feature, which of the following ocular feature is of myasthenia gravis? So again, we know that in myasthenia gravis, most commonly ptosis is there, which is bilateral, and diplopia is there. So ptosis and diplopia. So first option is ophthalmoplasia, exophthalmoplasia. No, it is seen in hyperthyroidism. And dry eye. No, it is seen in Sjogren syndrome. Pigmentary retinopathy is also not seen, but ptosis is seen. So answer will be option number 4, ptosis. Generally, ptosis is bilateral and diplopia is also present. A 12-year-old boy present with the purpura, arthralgia, abdominal pain 1 week following the ingestion of one single tablet of 500 mg paracetamol. His urine microscopy shows the red blood cells more than 10. So hematuria is also present. What will be the possible diagnosis? So if we talk about the features, purpura, arthralgia, abdominal pain, and the red blood cell in urine, which is hematuria. So these all features are related to a disease called as HSP or the Hinox-Schönlein purpura. So here answer will be Hinox-Schönlein purpura. If we talk about the other option, then drug-induced purpura, it can be drug-induced purpura, but in drug-induced purpura, arthralgia is not present. So arthralgia not seen. Also, abdominal pain can be present, can not be present. Polyarthritis nodosa, no. And urticarial vasculitis also can do not have any such features. So, answer will be option number 4, Hinox-Schönlein purpura, which will have all the feature purpura, arthralgia, abdominal pain, and hematuria. The following is tuberculid. So what is tuberculid? Tuberculid means a condition or the dermatological skin related condition which mimics tuberculosis related derma conditions, but not it is not directly related to tuberculosis. So first option is lupus vulgaris. We know that it is directly related to tuberculosis. Lupus miliaris disseminator facie. This is also again related to tuberculosis. Then scrofluderma. This is also related to TB. But option number 4, lichen scrofulosum, is not related to tuberculosis, but it mimics to the tuberculosis related dermatological condition. So it is called as tuberculid. So answer will be option number 4. Lichen scrofulosum. Okay. Next question is affinity of hemoglobin to carbon monoxide is. So this is again a direct question. Affinity of hemoglobin is hemoglobin to carbon monoxide is about 210 to 250 times more than oxygen. So answer will be option number D, 210 times. Next question is morphine should be avoided in all patients except. So they are asking about which is not a contraindication for morphine. So in infants and elderly, yes, it is contraindicated. In bronchial asthma, of course, it is contraindicated. In hypertensive patient, no. In hypertensive patient, morphine can be given and it lead to decrease in the BP. So here it is not contraindicated. Head injury patient, yes, morphine is totally contraindicated in head injury patient. So here answer will be option number C, that in hypertensive patient, morphine can be given. It is not contraindicated. So answer will be option number C. Next question is epithelioid cells seen in acute inflammation, no. In granuloma formation, yes. In pneumonia, no. And in gangrene also, it is not present. So what are epithelioid cells? Epithelioid cells are the modification of the macrophages. Macrophages modify to form epithelioid cells. And these all macrophages, epithelioid cells, giant cells, and other cells forms the collar for the granuloma. So they are present around the granuloma, around the necrosis, and form the granuloma. So answer here will be option number B, granuloma. Now next question is megaloblastic anemia occurs due to deficiency of. So this is a direct question. We know that megaloblastic anemia occurs due to the deficiency of vitamin B12, and also it can occur due to the deficiency of vitamin B9, which is a folic acid. So answer here will be option number C. Next question is Philadelphia chromosome is translocation between chromosomes. So again, it is a direct question. We know that Philadelphia chromosome is present in the condition called as CML, chronic myeloid leukemia, and here the translocation of 9 and 22 will be there. So we know that ABR BCL fusion occurs, which lead to the increase in the tyrosine kinase activity. So for the treatment of the CML, we generally give the tyrosine kinase inhibitor such as imatinib, etc. So answer here will be option number A, 922. Which of the following is not a odontogenic cyst? So what are odontogenic cysts? Odontogenic cysts are those cysts which are related to either gums, jaw, or any oral cavity condition can be there, but they are mainly related to the gums and jaws. So now option A, periapical cyst, yes, it is a odontogenic cyst. It is related to gum and jaw both. Gingival cyst, of course, it is related to gums. Dentigerous cyst, again, it is related to the teeth. So it is related to the jaw. So it is a odontogenic cyst. Branchial cyst. Branchial cyst is not a odontogenic cyst. It is present in the neck. So it is not a odontogenic cyst. So answer will be option number D, branchial cyst. Large area of keratinization is seen in. So if we talk about the keratinization, then our first thing that come into mind is a malignant melanoma. But in reality, the large area of keratinization is seen mostly in the squamous cell carcinoma. So answer will be option number A, squamous cell carcinoma. Now next question is, in mitral stenosis, earliest changes in X-ray chest is. So we know that in mitral stenosis, first change will be left atrium enlargement. Left atrium enlargement will be there. Now this left atrium enlargement will lead to the straightening of the border of left border of the heart, straightening of the border of the left side of the heart. So option first is correct. And if it is of course a first change that occurs, curly B lines are coarse and non-dense. So this is not the earliest change, and generally curly bean lines are dense. So this is also not correct. Constriction of upper lobe pulmonary vein. This is also not present. Double contour of the right side of the border. So no, double contour of the left side of the border will be there, and it is also it occurs due to the left right ventricle enlargement. So it is also not a correct answer. So answer here will be that earliest change is straightening of left border of heart, which occur mainly due to the left atrium enlargement. Which of the following is not a feature of the lower motor neuron weakness? So we know that there are two type of weakness: upper motor neuron weakness and lower motor neuron weakness. If we talk about the feature of lower motor neuron weakness, then these features are: the decreased tone will be there, decreased deep tendon reflexes will be there, fasciculations are present. So let's talk about the options. First is fasciculation. So it is a feature of lower motor neuron weakness. Hyperactive tendon jerks. So this is not true because deep tendon reflexes or tendon jerks are generally hypoactive or decreased. So this is a false statement, false option. Now third option is decrease in tone. Yes, this is true. And segmental motor weakness. Of course, this is also true. So answer will be option number B. Hyperactive tendon jerks are not present in the lower motor neuron weakness, and these are present in the upper motor neuron weakness. So answer here will be option number B. Next question is, a chronic alcoholic patient present with the epigastric pain radiating to back, nausea, vomiting, and hypotension. Which of the following could be the diagnosis? So here it is given the patient is chronic alcoholic. Now the features such as epigastric pain radiating to back and nausea, vomiting, and hypotension. These are the GIT related features, and generally it is present in the case of pancreatitis. So epigastric pain with radiating to back is the feature of pancreatitis. And also the supporting features are also there, such as nausea, vomiting, hypotension. So it is a case of pancreatitis. Now first option is emphymatous. Pyelonephritis, no. These features are not present in pyelonephritis. Acute pancreatitis, yes, this is true, or this can be true because a chronic alcoholic patient is there, and we know that for acute pancreatitis, both gallstone and alcohol are the major risk factors. So answer can be option number B. Wernicke's encephalopathy. No, this is also not correct. Portal hypertension. Yes, in portal hypertension can be can occur in the chronic alcoholic due to the alcohol-related liver disease. But the feature such as epigastric pain radiating to back is not a feature of portal hypertension. So this is also not correct. So answer here will be acute pancreatitis. But now if we talk about the pancreatitis, then if we talk about the acute pancreatitis, then most common cause is gallstone. Second most common cause is alcoholism. But if we talk about the chronic pancreatitis, then most common cause is alcohol. Now next question is, which of the following is not a clinical feature of AML? So we know that in AML, leukocytosis can be there. This is true. Leukopenia can also be there. This is again true. Thrombocytopenia, yes, of course, this is true. And increased reticulocyte count, no. Reticulocyte increase is not related to AML. Um, increased reticulocyte occur in the case of the hematolytic disease. So whenever there is hemolysis, then increased reticulocyte count can be there. So in AML, the reticulocyte count remain normal or it can decrease, but it never increases. So answer here will be option number D, increased reticulocyte count. It is seen in hemolytic diseases. Now next question is, which of the following is not a cause of chronic kidney disease? So first option is diabetes. Of course, this is true because we know that the most common cause for the chronic kidney disease is diabetes. Hypertension, yes, hypertension will lead to chronic kidney disease in the long term. Glomerulonephritis, this is also true. A repeated case or the condition of the glomerulonephritis will lead to the chronic kidney disease. Rheumatic arthritis. So, rheumatic arthritis is not directly related to the chronic kidney disease. So, answer here will be option number D. Mm, Now, next question is, in which of the following conditions CT scan of the brain is not indicated? So, in acute trauma, yes, CT scan is done. Acute parenchymal hemorrhage, again, in any type of trauma or the head injury, it is done. In aneurysm, so in aneurysm, CT scan can be done, but better is CT angiography, or uh, more better is MRI or MR angiography. And in headache, if there is a headache whose cause is not known, then CT scan of the brain is indicated. So this is also true. So here the best answer will be aneurysm, in which CT angiography can be done, but better is MR angiography or MRI. So option number C will be the correct answer here. Which of the following is not a diagnostic criteria for the SLE? So we know that in SLE, malar rash is present. This is true. Pleuritis, which is the most common pulmonary feature of the SLE. This is also true. Lupus hepatitis, no. We know that lupus nephritis is present, but nothing like lupus hepatitis is there. So this is false. And oral ulcer, this is true. So answer here will be lupus hepatitis. Now, miliary tuberculosis. So, what is miliary tuberculosis? First option is, it occurs due to the hematogenous spread of the tubercular bacilli. This is true. Lesions are typically 10 to 20 millimeters in diameter. So, this is false. Lesions are very small, not so big. Is almost always sputum positive. So, no, there is no specification that it should be always sputum positive. and present with the large pulmonary cavity lesions. This is again false. Cavity lesions is present, but they are not large. They are very small. So this is again false. So answer here will be option number A, that miliary tuberculosis is due to the hematogenous spread of the tubercular bacilli. Next question is Graham-Steele murmur. So this is a direct question. We have to learn it. Graham-Steele murmur is a named murmur of pulmonary regurgitation. So answer will be option number A. Next question is cause of hyperthermia syndrome includes all except. So in hyperthermia syndrome, all those conditions are there which will lead to the increase in the body temperature and or the hyperthermia. So first is serotonin syndrome. This is true. We know that in serotonin syndrome, um, increase in the body temperature is there, hyperactivity is there. Malignant hyperthermia is of course related to the hyperthermia. Endocrinopathy. Um, this is also true. Endocrinopathy will lead to the hyperthermia. If we talk about any endocrinopathy such as the hyperthyroidism, then it is true that in a hyperthyroidism, hyperthermia will be there. Option number D, Sjogren's syndrome. No, Sjogren's syndrome is not related to the hyperthermia. Either the body temperature is normal or it can decrease, but it is never increased, or the fever is not present. Sjogren's syndrome is an autoimmune disease. Packed cells are stored in which of the following solution to increase the half-life up to 5 weeks at 2 to 6 degrees centigrade. So if we talk about normal, then it is for 21 days. Then if we enhance it, then it is for 35 days, and more it is 42 days. So for 21 days it is CPD, then for 35 days it is CPDA, and for 42 days it is SAGM. So here options are CPD solution, no, it is for 21 days. SAGM solution, it is mainly for the 42 days. Acid citrate solution, no, and liquid nitrogen, no. So here I think none of the option is correct. So for 35 days or the 5 weeks, correct answer should be CPDA. Burkitt's lymphoma is characterized by translocation of which gene? So this is a direct question. Burkitt's lymphoma is related to c-MYC gene. N-MYC gene is related to neuroblastoma. And cyclin D1, it is related to mantle cell lymphoma. So answer will be option number A, c-MYC gene. ADAM 13 deficiency is seen in. So this is again a direct question. ADAM 13 deficiency is seen in thrombotic thrombocytopenic purpura. Next question is aneurysmal dilation of arteries is seen in all except. So aneurysmal dilation of arteries is seen in Marfan syndrome. This is true. Lewis-Dietz syndrome, also in this also aneurysmal dilation of arteries is there, and Ehlers-Danlos syndrome it is present. But in Takayasu arthritis, the aneurysmal dilation is not present. Takayasu arthritis is a inflammatory condition of the arteries. So answer here will be option number D, Takayasu arteritis, in which dilation of the arteries is not seen. Criteria used to diagnose infective endocarditis is. So option number A, Jones criteria, no, it is for rheumatic fever. Nada's criteria, no. Ann Arbor criteria, no, it is for the Hodgkin's. And Duke's criteria, this is true. Duke's criteria is used for the infective endocarditis, which have major and minor criteria. So answer will be option number D, Duke's criteria. Multiple myeloma tumor cells resembles. So option number A, granulocyte, no. Plasma cell, yes. Lymphocyte, no. And chondrocyte, no. So we know that the multiple myeloma tumor cells resemble the plasma cells. Plasma cells proliferation is there. Bony metastasis can be evaluated by. So bony metastasis can be best evaluated by. They are asking about the best. So X-ray, no. 99 technetium bone scan, yes, this is true. 111 indium scan, no, this is not the best scan for that. And calcium alkaline phosphatase elevation, so it is not used for the bone metastasis. It is used for the other bone related disease. So answer will be option number B. Technetium 99 scan is used for the bony metastasis. Bone metastasis is in male commonly arise from the cancer of. So we know that it is most commonly associated with the prostate cancer. So answer will be option number B, prostate cancer. So if we talk about other option, then lung, kidney, thyroid, uh, the primary cancer in these area can also lead to the secondaries to the bone, but most commonly it is seen with the prostate. All are true regarding hemolytic transfusion reaction except mainly caused by the ABO incompatibility. This is true. Potentially fatal if associated with multi-organ failure. This is also true. Associated with extravascular hemolysis. This is false for the hemolytic transfusion reaction, which are mainly intravascular. Mediated by the complement system. Yes, this can be true. So answer here will be option number C, associated with the extravascular hemolysis, which is false because hemolytic transfusion reactions are mainly the intravascular hemolysis, will have intravascular hemolysis. Next question is, in patient with the bacterial endocarditis, which of the following echocardiography findings lead to embolization? So, firstly, we know that embolization generally occur whenever there is any vegetation on the mitral side. So, option cannot be tricuspid vegetation. So, this is false. Option number 3 and 4 is not true. Now, in mitral wall vegetation 5 mm and mitral wall vegetation 11 mm. So, 11 mm vegetation is bigger, and the breaking of this vegetation can lead to the formation of the emboli. So answer here will be option number B, metal wall vegetation 11 mm. So next question is, Naser score includes all except. So what is Naser score? Naser score is the prognostic score which is used for the Wilson disease. Now Naser score has BAP, which is bilirubin, AST, and PT. And the score less than 7, medical management is done. 7 to 9, medical management or surgical management can be done, depends on the condition of the patient. But if it is greater than or equals to 10, then liver transplantation is the only treatment. So Naser score will include bilirubin, this is true. AST, this is also true, and PT. But albumin is not included in the Naser score, so answer will be option number D, and it is mainly for the Wilson disease. Inclusion body is seen in progressive myoclonic epilepsy. So if we talk about the Bashino bodies, then it is present in the liver or the virus diseases. Levy body is seen in Parkinson's. Hirano bodies is seen in Alzheimer's. Lephora bodies. So Lephora bodies is present in the progressive myoclonic epilepsy. So answer will be option number D, Lephora bodies. Next question is Alzheimer disease associated with. So this is a direct question. We know that Alzheimer disease is associated with Down syndrome. So it is related to the chromosome number 21. Option number A will be the correct answer. Next question is treatment option of relapsing, remitting, multiple sclerosis are all except. So interferon 1B, yes, it is used for the relapsing, remitting, multiple sclerosis. Interferon 1A, this can also be used. Glatiramar acetate, yes, of course, it is also used. TNF is not used in the treatment of multiple sclerosis. So this is not true. So answer here will be option number D, TNF, which is not used for the multiple sclerosis treatment. Next question is in chronic dialysis, most common CNS manifestation is. So it is a direct question. We know that in chronic dialysis, most common manifestation is the dementia. So answer will be option number C, which is dementia. Dementia is the most common CNS manifestation after the long-term therapy of the dialysis. Which of the following defines the microscopic hematuria? So microscopic hematuria is 3 or more RBCs. So this is true. Option number 1 is correct answer. Con syndrome characterized by all except. So polyuria, this is true. Polydipsia, yes, of course, this is also present. And weakness will be there, this is also true. And anasarca, which is the whole body edema, this is not seen in the Con syndrome. Con syndrome has the increase increased water will be there in the body due to the more absorption by the aldosterone, but anasarca is not present. Anasarca or the whole body edema generally occur due to the third space loss of the fluid, which is not seen in the case of the Con syndrome. Answer will be option number D. That anasarca is not seen in Con syndrome. True about pseudo hypoparathyroidism. So what is pseudo hypoparathyroidism? So it is a condition in which uh, parathyroid hormone is normal or it is increased, but the features are similar to the hypoparathyroidism. So in which is true about the pseudo hypoparathyroidism, that increased calcium is there? No. Instead, decreased calcium will be there because the feature is related to the is similar to the hypoparathyroidism. Decreased phosphate? No. Increased phosphate will be there because in hypoparathyroidism, decreased calcium is there and increased phosphate is there. So this is also false, that increased phosphate should be there. Increased PTH? Yes, this is true because in pseudo hypoparathyroidism, PTH in body is increased, but it is not able to work on the receptors. So the feature will be related to the hypoparathyroidism, but in actuality PTH is increase. Increase response to urinary CAMP on PTH? No. So answer here will be option number C, which is increase PTH. Next question is, in a normal person at the resting condition GFR is, so this is a direct question, GFR normally is 125 ml per minute. Next question is, mean arterial pressure is calculated by, so normally it has a formula which is 1 by 3 SBP plus 2 by 3 DBP. So answer here will be option number A, which is SBP plus 2BP, 2 DBP divided by 3. So answer here will be option number A. Which of the following is true about fourth heart sound? So it can be heard by the unaided ear? No, this is not true. It is a low pitch sound. Frequency is greater than 20 hertz? No, this is again a false statement. Heard during ventricular filling phase? Yes, this is true. Both S3 and S4 are generally seen or heard during the ventricular filling phase or the filling phase. Heard during ventricular ejection phase? This is false. So answer here will be option number C, heard during ventricular filling phase. So so if we talk about this diagram, then S4 is generally seen in this area, which is a ventricular filling phase. What is the normal value of glomerular filtration rate? So we have already seen it, that it is 125 ml per minute. Okay. So if we calculate it for a day, then it will be 180 liters per day. Answer will be option number C, 180 liters per day or 125 ml per minute. Next question is, hormones secreted from pancreas are, so insulin and glucagon. This is true. Insulin, glucagon and somatomedin. No, somatomedin is not secreted from the pancreas. Insulin, calcitonin and thyrosin. This is also false. Calcitonin is not secreted and thyrosin also not secreted from pancreas. Insulin, glucagon and somatostatin. So this is also true. So from the option number A and D, better answer is option number D because it has all three, insulin, glucagon and somatostatin. So answer will be option number D. Which of the following is not a feature of the Parkinson disease? So we know that the for Parkinson main features are BTR, which is bradykinesia, tremors and rigidity. Now tremors are mainly resting tremors. So what are the options? First is intentional tremors. So this is false because resting tremors are present. Rigidity, this is true. Rigidity is present in Parkinson. Mask-like face, this is also true. And fasting and gait, this is again true. So intentional tremor, option number A is not related to the Parkinson disease. Resting tremor should be there. In normal ECG, T wave is negative in. So this is a direct question. We know that in ECG, T wave is negative in AVR. So answer will be option number D, AVR. Which one of the following is the malignant tumor? So if we talk about the lipoma, then lipoma is a benign tumor and which is the most common benign tumor of the body. Meningioma is again a benign tumor. Seminoma or dysgerminoma, they are the malignant tumors. And leiomyoma is again a benign tumor. If they give leiomyosarcoma, then it is a malignant tumor. But leiomyoma is benign tumor. So answer here will be option number C, seminoma. In female, it is